I often have patients come to me and say, Doc, what can you do for me? I'm aging. I want to look younger. I don't know specifically what I see in the mirror, but I want to look facially rejuvenated. If that's the case, we start with looking at the entire shape of the face. Men are a little bit more rectangular, women a little more triangular or trapezoid. So, for instance, if you have too much tissue inferiorly and not looking like you want in terms of shape, then addressing the lower part of the face, narrowing that would be indicated. Some people, their mid face is too narrow, and then putting something like an implant to widen that would be beneficial. So the shape of the face is the most important thing. Then we divide the face into upper, middle, lower, and neck. So then we concentrate in each one of those. The number one procedure done in the United States is neuromodulators for animation wrinkles. So we often look at the forehead, glabella, crow's feet, and having a muscle relaxant to help those animation wrinkles. Then we move to the brow. Is the brow higher than it needs to be or lower than it needs to be? Men and women are different. Male have a straight brow, women a more hockey shaped brow that optimizes their aesthetic appearance. If they have extra skin in the upper eyelid, we'll talk about removing that, doing an upper eyelid cosmetic eyelid surgery. If they have fat herniation in the lower eyelid or extra skin, we can address that with a lower eyelid cosmetic surgery. The number one place that people age is losing volume in the tear trough below the lower eyelid. So there's a variety of procedures that we can do to volume replace that with either an absorbable filler, such as an hyaluronic acid filler, Juvederm, Restylane, Versa. We could use Balafil. Be careful not to put excessive amounts. We can use your own fat, both in the tear trough area and throughout the entire face. And we can even use an implant. Okay. If they have temporal volume deficiency, volume in that area would be indicated as well. Then we move down to the middle face, which is probably for most people the most important. Putting an implant through your mouth that you can't see the incision that elevates the mid face and gives volume is an excellent choice. Some patients, when they have a lower and mid face drooping, that's when we do the standard deep plane facelift. That's going to give you the best result. The reason it's called deep plane, we're cutting the ligaments that are inhibiting or anchoring the face from being lifted. So doing an incision along your hairline in front of the ear around your earlobe, very hard to see. I've revised one in my entire career. Doing a deep plane facelift, it helps both the middle face, the lower face, and even the neck. Some people need an incision below the chin that sutures the platysmal muscle together. And then when we pull it backwards, they get an optimal neck appearance. So a full evaluation we do with photos, front, oblique, side views. Sometimes I take those photos and then morph them, which means we change them on the phone and show them immediately what they would look like. So what we're trying to do is from the bone all the way up to the skin, optimize your aesthetic appearance, and it often needs a combination of procedures. Probably the most common thing that I do is one, do upper eyelid surgery, two, volume replacement in the lower eyelid, three, a deep plane facelift with a neck lift, and then we stage about a month later laser skin resurfacing. That is the most common overall facial rejuvenation procedure that we do in someone who's middle aged.